Connected to COVID-19 that's been seen in New York and in other countries is now showing up here in the St. Louis area. It's an extreme reaction to the virus striking children that's similar to something called Kawasaki syndrome. Russell Kinsall spent the day learning more about the local patients and what parents need to know. He's live at Children's Hospital.
Yeah, Corey, right now doctors here at St. Louis Children's Hospital are telling me that they've treated at least 2 teenagers for what's being called Pediatric multi-system inflammatory syndrome. All of them recovered. They're at home. They're doing much better now, but doctors are really trying to find out more about this mystery illness.
We're hearing a lot of these stories about this inflammatory syndrome, and they're scary.
Dr. Jason Newland is an infectious disease physician at St. Louis Children's Hospital. He says the news is good about the patients in St. Louis who've had this mystery illness.
All the children we've cared for with COVID-19 have done well, including these with this type of syndrome.
Here's video from CNN of a 9-year-old boy in New York who developed this syndrome. Usually it shows up 3 to 4 weeks after first getting sick with COVID-19, starting with a fever.
The main symptoms it appears in children right now is prolonged fever. So these consistent fevers over 101 degrees Fahrenheit, if not over 102.
Besides a persistent fever, the other symptoms include a rash, swollen neck glands, and redness in both eyes. Doctors say parents seeing symptoms need to get their child to a doctor and should not be fearful about doing that.
It's okay to go to your healthcare providers, especially for children. Make sure you're getting the vaccines. And let's just remember that we have safe places because of all the work that's being done there, but also because of the work that you all have been doing in the community to keep yourselves safe.
The mystery illness appears to be an overreaction of the immune system. It causes inflammation of the walls of the arteries, and that can stem the flow of blood to the heart. It's similar to a condition called Kawasaki syndrome, but doctors say there is still much to learn.
We're learning, and we're going to help inform people and look forward to the day when we can talk about the history of the COVID-19 pandemic.
So the good news is this is very rare. There have only been a few deaths, none here in St. Louis, and the vast majority of children who have developed this syndrome have recovered. Live in the Central West End, Russell Kinsall, News 4.
The Greater St. Louis Pandemic Task Force continues to report